This is another installment on how to start a home healthcare agency. When launching your home healthcare agency, you will need to be prepared to be surveyed by the state or an accreditation body, or even both of those. This survey is meant to prepare you for the real world and catch any mistakes in your organization that can become a problem down the line. Here on ENTP Life, I mostly talk about my real estate investments and business ventures. One of my businesses is a multi-million-dollar home health care company operating in 2 states. My goal is to teach people how they can earn enough money to live out their life's dreams. So if you're tired of the rat race and looking to live life on your terms, make sure you like this video and subscribe to the channel to get motivation so that you can go out there and live your dreams. My name is Karl Pierre, and this is ENTP Life. Starting a home healthcare agency isn't easy. A lot of healthcare professionals think it's a simple way to get into entrepreneurship, but it's not. Fortunately, for those of you who have doubts or have been struggling with getting started in home healthcare, I have another option. I'm putting together a mentoring program for starting a healthcare staffing agency, which is much easier and also just as lucrative. You can email me at my email below if you're interested in being on that contact list so I can keep you up to date. The program releases in June 2021, so get in contact with me. It's really structured a lot like my real estate investment program, Killing the American Dream, so it's meant to put you on the right track to get you started as soon as possible. For those of you who are still pressing on to get your agency going, let's get into it. In preparation for your home healthcare agency survey, you're going to need policy and procedures for your entire operation. This includes your admissions packet, your employee handbook, various states and federal policies, your HIPAA policy, your patient bill of rights, your agency emergency plan, organization documents, quality improvement plan, and a whole bunch of logs. Additionally, you're going to need a few employees and patients. You may be thinking, how am I going to get this if I just got started? I'll explain. Let's first talk about getting your first employees. In getting your first employees, you first start with the founders of the business typically. Usually one of the founders is going to be a nurse or a business person. If you are a nurse, you're going to be filling in as the director of nursing, and if you're the business mind behind the business, you're going to be filling in as the administrator. But you're also going to need the caregivers that are going to be providing care to the patients that you will be servicing. These caregivers are going to include other nurses, whether they're RNs, LPNs, speech pathologists, physical therapists. You might have a physical therapist aide, nurse aides, home health aides, all the people who are going to be in contact with the population that you're going to be servicing. Now, to get these first few employees that aren't the founders, you're gonna have to put out ads. You're gonna have to put out ads on Facebook, on Indeed, on whatever job portal. Maybe you're gonna be using Google Ads, whatever you're gonna need to use to get those first employees in. Remember, when you're getting surveyed, they wanna make sure that you're running like a proper business. So they're gonna wanna review those initial employees' files, and they're gonna also review the work that they're doing. The next thing is getting your required patients. This is the tricky part. Getting your first few patients can come a few different ways. A lot of agencies usually build their initial roster with friends and family because you're gonna be providing these services for free. So they go out there, they get grandma, grandpa, older uncles, whoever they feel can qualify as a patient, put them on their roster and start treating them. What we did at AidBook is that we decided that we were going to go out there and admit real patients because we wanted to give all of our initial employees that real look at what it's like to care for patients. So we really provided pro bono work, and the way that we built our initial patients is that we went out there, we developed relationships with social workers and case managers in the hospitals, and we specifically told them that we're looking to provide services for people who are not insured but require home health. Since we knew that we weren't going to get paid, we wanted a fair shot at processing these patients that would go through the cracks anyway, providing a good service to the public while building our roster so that we have real care that we've given, so that when we are surveyed, it's with real patients. If you just fluff up your roster with kind of fake patients, you can do that, but you're really going to be losing that real world effect of what it's like to admit a patient. I believe in taking it seriously from day one, so that when you do get started and that first paying patient comes on board, that you're going to be able to process that patient with very little hiccups. Another thing that you can do is you could find private paying patients that are especially going to be paying for personal care. You can build your book out with those sort of clients and use them to qualify for your initial threshold of patients that you need to service before a survey. Now, here in Florida, we were getting accredited as a Medicare agency through CHAP. And what they required is that we had 10 patients that were admitted and serviced by our company and 7 active at the time of survey. So we needed to have at least 3 people or 3 clients discharged from our care because they wanted to review both our active patients and patients that we discharged so that they could see the entire cycle and make sure that we're covering everything from screws to nuts. So what's next after you've started running your agency? If you've onboarded employees and you've onboarded patients and started to provide services to those patients, you're actually in business and your agency is actually moving, okay? Now, while you're waiting for your survey, you could really go out there and find as many private pay clients as you'd like, or even try to get in network with some payers that don't require you to be accredited. Obviously, that's the best thing for you to do because you're going to be bleeding money on office space, on staff, and all these other things. If you're not capitalized to do that, I highly recommend that you go out there and find some patients that are going to bring some money into the doors. But at this point, you are a fully functional agency. You're already licensed by your local Department of Health. You have patients under your care. It's time for you to start acting like a real agency. Go out there, build relationships with your potential referral sources, build on your marketing material, build on all the day-to-day structural things that are going to be occurring within your company. Remember, take this time to really build out the type of organization that you're going to be because it's going to be a short time from now that you're in the real world providing real services. And if you take it seriously from day one and you onboard real patients, real employees, and you're trying to maintain survey readiness from even before you start getting paid, those habits will carry over into when you're really a practice. There's a lot of mom and pop shops that enter this industry, and you see a lot of the mistakes that they make. You could go out there, you can make money, you could have an agency, but you're going to constantly be getting flagged by your accrediting body for some of the mistakes that just kind of come through the growing pains. If you take it seriously and you run your agency by the book from day one, you could avoid all those mishaps and all those setbacks. Hopefully you've learned what to expect in getting prepared for your survey. In the next video, I'll be going over our Medicare credentialing survey with CHAP and what to expect in that process. Once again, thank you for joining me here at ENTP Life, and don't forget to live out your dreams.